So now we're moving into the final part of the digestive process, which is known as defecation. And what is happening here is there are mass movements in the bowel that are forcing the feces towards the rectum. And any type of distension will initiate the spinal defecation reflex. And this reflex is mediated mainly by parasympathetic signals. Anytime there is a stimulation of the parasympathetic signal system, this can stimulate the contraction of the sigmoid colon and the rectum. And parasympathetic signals are also involved in relaxing the internal anal sphincter. Conscious control allows for relaxation of the external anal sphincter. And the muscles of the rectum will contract to expel the feces out of the body. And this is assisted by a maneuver called the Valsalva's maneuver. And what happens during the Valsalva's maneuver is the glottis is closed, there's a contraction of the diaphragm, and the abdominal wall muscles will cause an increased intra-abdominal pressure. The levator ani muscle will contract, and this causes the anal canal to be lifted superiorly and allows for feces to leave the body. So you can see on this picture here the three main parts of the defecation reflex. We've talked about these already, but let's just go over them again. So feces is moving into the distended rectum, and there's parasympathetic innervation causing activation of the stretch receptors, and then the receptors will transmit signals along the afferent fibers to the spinal cord neurons. And the spinal reflex is then initiated, and then if it is convenient to defecate and there is a conscious control that you basically tell yourself, okay, I'm on the toilet now and I have the capability to defecate, the voluntary motor neurons can be inhibited, and this will allow for the external anal sphincter to relax so the feces can pass out. So remember, we said that one of the main functions of the large intestine is to absorb any remaining water from the digestive process from the bolus of food that's being broken down coming to it from the small intestine. If the large intestine doesn't have sufficient time to absorb the remaining water, this could result in a condition known as diarrhea. I'm sure we've all experienced issues of diarrhea throughout our lifetime, and diarrhea can be problematic if it's not treated, because if a patient has prolonged diarrhea, this may result in dehydration and electrolyte imbalance. So this could cause acidosis as well as potassium loss. And another common complication of the digestive system is constipation. And what happens here is there's food that remains in the colon for a long time, and the food is in the colon and too much water is being absorbed throughout the gastrointestinal tract, especially in the large intestine. And what that does is it makes the stool really hard and difficult to pass. One of the main reasons of constipation that results from a dietary insufficiency is a insufficient intake of fiber or an insufficient intake of fluid. It's suggested to drink at least 40 ounces of water per day. That's 5 8-ounce bottles or 8-ounce glasses of water. I advise to drink more. I would say to drink at least 100 per day to allow 100 fluid ounces per day to allow for the digestive tract to initiate and complete all the processes that it has to undergo on a daily basis in a sufficient manner. Constipation could also result from improper bowel habits, lack of exercise, and laxative abuse. We see laxative abuse in patients that have anorexia nervosa as well as bulimia nervosa. Now we're going to move into some of the mechanisms of digestion and absorption. And as you all may know, digestion breaks down our ingested foods into their chemical building blocks. And only these molecules are small enough to be absorbed across the wall of the small intestine. So When we break something down, that's known as a catabolic process. When we build something up, that's known as an anabolic process. So you may have all heard of anabolic steroid use. So that's building up muscle fibers. And catabolic processes or catabolism is breaking something down. So what digestion does is it breaks down the macromolecules into monomers that are small enough for absorption. Both the intrinsic and accessory gland enzymes are involved in digestion, and these enzymes are responsible for carrying out a process known as hydrolysis, which this is where water is added to something to break chemical bonds. And absorption is the process of moving substances from the lumen of the gut into the body. So we have these things in our gut that help form a barrier between the gut and the rest of our body, known as tight junctions. And they ensure that molecules pass through the epithelial cell rather than between them. And the materials enter the cell through the apical membrane. This is on the lumen side of the cell. And they exit through the basolateral membrane. This is on the blood side. Lipid molecules can be absorbed passively through the membrane. So the more something is lipid soluble, the easier it is for it to pass through the membrane. So ideally, molecules that are lipid soluble as well as nonpolar are passed through the membrane easily. However, if the molecule is polar, they're absorbed by a process known as active transport. And most of the nutrients that we consume are absorbed before the chyme even reaches the ileum. Remember, the ileum was the most distal part of the small intestine right before it turns into the large intestine. So let's talk about carbohydrates and how we digest carbohydrates. So a carbohydrate, if you look at the chemical structure of it, it's a very complex structure. So only the monosaccharides can be absorbed. So the starch and disaccharides are broken down into the oligosaccharides as well as disaccharides. So this begins in our mouth with the enzyme known as salivary amylase. And you can see on the chart here how our foodstuffs get broken down into the more simple molecules such as galactose, glucose, and fructose, which our body can finally use. So as the food stuff is being broken down in our mouth by the enzyme salivary amylase, it is then further broken down into lactose, maltose, and sucrose. However, those are still too big for digestion, so we have to break them down even further. So we break them down into the final monosaccharides, and those are depicted at the bottom of the chart, and they include galactose, glucose, as well as fructose. So this is a nice schematic that shows you how carbohydrate digestion and absorption occur in the small intestine. So we've talked about how pancreatic amylase is responsible for breaking down starch or glycogen into the oligosaccharides as well as some disaccharides. Next, what happens is the brush border enzymes, which include many different enzymes such as dextrinase, lactase, glucoamylase. These further break down the oligosaccharides and the disaccharides into lactose, maltose, and sucrose, and then finally help to break down these components into the monosaccharides, which we've mentioned on the previous slide. The monosaccharides include glucose, fructose, and galactose, which our body can utilize. So the monosaccharides are co-transported across the apical membrane of the absorptive epithelial cell, mostly by secondary active transport with sodium. And there's a concentration gradient established by the sodium-potassium ATPase pump. This pump's located in the basolateral membrane. You can see that on the bottom of your screen right before you can see the capillary, right above the capillary. And then finally, once the monosaccharides are transported, they will exit across the basolateral membrane by a process known as a facilitated diffusion. So a very common issue that many people experience is lactose intolerance. And if you look on the picture here, you can see that in food items that many of us eat in our daily routine, the lactose amounts are very small, but people who have lactose intolerance, even these small amounts can cause really complicated systemic inflammation and other complications. So people who are lactose intolerant, they have a deficiency in the enzyme lactase, which helps to break down lactose. So what happens in lactose intolerance people, the lactose will remain undigested, and it creates an osmotic gradient in the intestine that prevents water from being absorbed, and this can result in diarrhea. And this can also pull water from the interstitial space into the intestinal lumen. And any type of bacterial metabolism of undigested solutes produces large amounts of gas, and this could result in bloating, flatulence, and cramping pain. It's a very simple treatment that if you are lactose intolerant and you just love ice cream, or you just love a bowl of cottage cheese or having milk with your cereal, you can simply add lactase enzyme drops to the milk, or take a lactase tablet before consuming milk products. And this will allow you to consume the products that you see on the screen that have different amounts of lactose in them. Having fats in our diet is an essential component to having a healthy diet. We want to have good fats in our diet, but we don't want to consume too much of the bad fats. And our digestive system has developed a really intricate way to digest lipids. And the way the digestive system digests lipids is very different from the way it digests other components and materials. So as you can see depicted on the slide here, there are 6 main steps in how lipids are taken in, digested, and then absorbed. So lipid is interchangeable with the word fat, so I'm going to use those 2 words interchangeably. The first process is known as emulsification. This is when the triglycerides and their breakdown products are insoluble in water, and there has to be some type of pre-treatment with the bile salts that break down the large fat globules into smaller ones. And the fat globules are going to be broken down, and once they are broken down into a size that is satisfactory for the digestive process to occur, the pancreatic lipases will break down those products into a monoglyceride plus 2 free fatty acids. And then what happens is something known as micelle formation. So these are products from the digestive system that become coated with bile salts and lecithin. And then after the micelle formation, the fat droplets are able to be diffused. So the lipid products will leave the micelles and cross the epithelial membrane through the process known as diffusion. And then once they cross the membrane, chylomicron formation occurs. So the lipid products are converted back into triglycerides, and they're packaged with lecithin and different types of lipoproteins, and they form a substance known as a chylomicron. And then the chylomicrons have to be transported after that. So they are exocytosed from the basolateral side of the membrane, and they enter the lymphatic lacteal. And eventually the chylomicrons are emptied into the venous blood at the level of the thoracic duct. So now let's look at how our body breaks down and digests nucleic acids. What our body has to do is it has to break down the nuclei of ingested cells in our food, which contain DNA and RNA. So we use pancreatic nucleases to hydrolyze the nucleic acid into nucleotide monomers. And the brush border enzymes, nucleosidases, as well as phosphatases break down the nucleotides into free nitrogenous bases, pentose sugars, and phosphate ions. Then these components are actively transported by special carriers in the epithelium of the villi. We're going to talk more about the vitamins in the metabolism and nutrition chapters. However, I do want you to know the vitamins that are classified as fat soluble versus those that are classified as water soluble. And I've listed them on the screen here for you. So the way the fat soluble and water soluble vitamins are absorbed is very different from one another. The fat soluble vitamins A, D, E, and K are carried by the micelles and they diffuse into the absorptive cells. While on the other hand, the water soluble vitamins B and C are absorbed by diffusion. They can also be absorbed by passive or active transporters. And I've listed vitamin B12 separately here. It is a water-soluble vitamin, but it is a large charged molecule, and it binds with intrinsic factor, which we're going to talk about more in the metabolism chapter and how important intrinsic factor is to our daily metabolism. However, vitamin B12 has its own unique process of absorption and is absorbed by endocytosis. Most ions that are running through our gastrointestinal system are transported actively along the length of the small intestine. The electrolytes iron and calcium are absorbed in the duodenum. Sodium absorption is coupled with active absorption of glucose and amino acids. Chloride is continuously being transported actively, and potassium diffuses in response to different osmotic gradients. And potassium is easily lost if water absorption is poor. And iron and calcium absorption is related to the need of the body. So our body has the capability to store iron, and ionic iron is stored in the mucosal cells with ferritin. And then when it's needed, it's transported in the blood by transferrin. Calcium absorption is regulated by vitamin D as well as the hormone known as PTH, the parathyroid hormone. And our body is mostly made of water, so we have to have some type of mechanism to absorb water. And 95% of the water in our body that gets absorbed is absorbed by osmosis in the small intestine. And then the remaining water is absorbed in the large intestine. And water uptake is coupled with solute uptake, and there is something called a net osmosis. And this occurs if a concentration gradient is established by an active transport of solutes. Malabsorption can be caused by anything that interferes with the delivery of bile or pancreatic juice. And malabsorption can cause damage to the intestinal mucosa. This can result from bacterial infections as well as some antibiotics that can irritate and cause damage to the gastrointestinal tract. And very common pathology is known as gluten-sensitive enteropathy or celiac disease. So what happens here is the patients with this condition will have an immune reaction to gluten. And if they consume gluten, you can see on the picture here, it's going to cause damage to the intestinal villi as well as the brush border. So the villi undergo atrophy and the brush border gets deteriorated, and there's a lot of complications from celiac disease, including malabsorption. It could lead to constipation, flatulence, excessive diarrhea, and it's a very simple treatment. Just eliminate gluten from your diet and celiac disease will basically resolve itself. When you all become clinicians, these are two common pathologies that you all may come into contact with. So let's talk about the picture in the upper left-hand corner of the screen first. The baby on the left side shows a cleft palate, while the baby on the right side shows a combination of a cleft palate and a cleft lip. And these conditions can result when the palatine bones or the palatine processes of the maxilla, or both of them together, fail to fuse. And this can be very dangerous to the baby because it makes the baby unable to suck properly. So if the baby can't suck properly, it can't obtain the essential nutrients that it needs from the mother. Luckily, with how far we've come with surgical intervention, this is a very easy pathology to repair. The surgeon simply goes in and does a procedure and can easily repair the cleft lip and the cleft palate, and the baby will live a very normal and healthy life. Another condition, genetic condition that we've talked about before, is cystic fibrosis. So there's a genetic mutation in the CFTR gene, and this is a disease that produces thick mucus that can block the pancreatic duct, and the patient will have recurrent infections and lifelong complications. As we age, especially if we do not take care of our bodies will begin to deteriorate. And the GI tract will show a lot of different changes as we age. For example, the GI will start to produce less digestive juice, absorption will be less efficient, peristalsis will slow, and this will result in a decline in frequency of bowel movements, so we may experience urinary or fecal incontinence, or both. Our taste and smell become less accurate, and we can develop periodontal disease. Also, we've talked about diverticulosis. Diverticulosis is seen in almost 70% or more of people who are age 65 or older. And as we age too, we're more susceptible to cancers, especially cancers of the GI tract. The stomach and the colon cancers rarely have early signs or symptoms. That's why they can be so dangerous, because we don't start to detect them until they've metastasized. And one of the frequent spots they metastasize to is the liver. So stomach and colon cancers can cause secondary liver cancer. And by the time, especially if we're of an elderly age, by the time we go to the oncologist for treatment, it may be too late to treat the cancer and cure it. Oral cancers due to periodontitis can be detected during dental exams. The good thing about GI cancers is if they are detected early, most of them are treatable and they have a very high remission rate. So as you age, take care of your body. Go do regular dental exams and medical exams and exercise regularly. And take all of what you learned in this digestive lecture and what you've learned in this course so far to eat healthy and be of sound body, mind, and spirit.